The story is about a doctor's office. There's a doctor, a nurse, a receptionist, and a telephonist. The doctor normally does all the prescribing of medication and obviously tells the patient what he believes is wrong with them. The nurse in this case is there to help the patient understand exactly what the doctor is saying, because many times people in general doesn't really understand what doctors are saying, and nurses, through their education and how they were taught, will explain it in more layman's terms to the patient what exactly is wrong with them, what medication the doctor will prescribe, and things like that. The receptionist is there to take bookings on the doctor's behalf. They control the doctor's diary. They will explain to the patient when they can see the doctor or when they can't see the doctor, and make special arrangements accordingly. The rest of the story is about a conversation between the receptionist, the nurse, and the grandmother. The grandmother gets to the doctor's office. The receptionist greets her. The grandmother says hello. She asks what is wrong. Grandmother says she's having trouble sleeping. The receptionist explains that the doctor is not there at the moment and he will be back in the afternoon. But the nurse is there. She can speak to the nurse. The nurse then came out, greeted the grandmother, went into the room, explained once again to the grandmother that the doctor is not available and that he will only be there in the afternoon, but she will listen to what the situation is. The grandmother explained that she is getting headaches. The nurse then asked if she's taking her blood pressure medication on a regular basis. The grandmother says, yeah, she thinks so, but these days things tend to happen and she might not have taken it as required. The nurse then suggested they take her blood pressure, which then showed as very high. She then explained to the grandmother that there is a problem if she doesn't take her medication on a regular basis, but she suggested that the grandmother comes back in the afternoon to see the doctor, and maybe then he can subscribe her or prescribe her a different medication. The grandmother said thank you, and she will ask her son to accompany her in the afternoon. The nurse also suggested that she take some headache tablets and lots of water, and that should make her feel a lot better. The grandma left the nurse's office and greeted the receptionist and said goodbye, and left. And that is the story.